In this podcast episode, U.S. Surgeon General Vivek Murthy discusses the loneliness epidemic and its impact on mental and physical health. Murthy begins by emphasizing the importance of addressing loneliness and mental health issues in order to build a healthier society. He states that if we don't prioritize rebuilding connections in our individual lives and in society as a whole, we will continue to see an erosion of relationships and an increase in loneliness. Murthy highlights the alarming statistics surrounding loneliness, stating that 1 out of every 2 Americans is experiencing measurable levels of loneliness. He compares this number to the number of people suffering from diabetes, emphasizing the magnitude of the problem. He also notes that rates of loneliness are even higher among young people, despite the assumption that technology and social media would increase connectivity. The impact of loneliness goes beyond mental health and is associated with an increased risk of heart disease, stroke, dementia, and premature death. Murthy explains that chronic loneliness puts the body in a state of chronic stress, leading to a cascade of inflammatory factors that increase the risk of illness. The Surgeon General's role is to raise awareness about critical public health threats and provide concrete actions that individuals and communities can take to address these issues. While the advisories issued by the Surgeon General do not have the power to enforce action, they serve to call attention to urgent issues and provide a national strategy for addressing them. Murthy emphasizes the importance of building public understanding and support for policies and programs, as sustainable change requires a cultural shift. Murthy shares his personal experiences with loneliness and isolation, starting from his childhood when he struggled to make friends and felt a sense of shame about his loneliness. He also discusses his experiences as a doctor, encountering patients who felt isolated and alone in the hospital. These personal experiences, along with the stories he heard from people across the country, motivated him to focus on addressing loneliness. The podcast delves into the factors that have contributed to the loneliness epidemic. Murthy identifies increased mobility, the decline of extended families, decreased participation in community organizations, the rise of convenience technology, and the impact of social media as key factors. He explains that while technology has made life more convenient, it has also led to a loss of informal connections and increased feelings of isolation. Murthy emphasizes the need to consciously prioritize rebuilding connections in our lives and communities. He highlights the importance of recognizing that loneliness is not just an American phenomenon but a feature of modernity experienced in many countries. He suggests that while we don't need to go back to the past, we need to actively work towards creating a more connected society. The podcast continues by discussing the neurochemistry of loneliness and the behavioral patterns associated with it. Murthy explains that loneliness can lead to a state of hypervigilance, where individuals become suspicious of others' intentions and withdraw further. He emphasizes the importance of recognizing the signs of loneliness in ourselves and others and making an effort to reach out and connect. Murthy also reflects on his recent visit to Europe and how the infrastructure of cities overseas is designed to cultivate community and connection, unlike many cities and suburbs in the United States. He emphasizes the need for social infrastructure that supports healthy relationships and connections among people. The conversation then shifts to the responsibility of government and the private sector in addressing the issue of loneliness. Murthy suggests that the government can play a role in identifying loneliness as a national priority, investing in research to better understand effective strategies, and examining policies through a connection lens to promote healthy relationships. He also highlights the importance of intentional workplace and school design to foster connection and community. Murthy emphasizes that individual actions and cultural change are also crucial in addressing loneliness. He encourages individuals to prioritize relationships, give others their full attention, and engage in acts of service and kindness. He believes that these small actions can make a significant difference in combating loneliness and building stronger connections. The conversation then delves into the impact of loneliness on national security. Murthy explains that when people are divided and isolated, it becomes easier for foreign adversaries to exploit the information environment and create confusion. He also expresses concern about the potential for loneliness and alienation to lead to anger and violence, particularly among young people. He emphasizes the need for healthy pathways for individuals to build community and address their feelings of loneliness and alienation. Murthy acknowledges that addressing loneliness and building connections is a complex task that requires a revolution of consciousness. He believes that a moral renewal is needed, where society recenters on core values such as kindness, generosity, service, and friendship. He emphasizes the importance of leaders modeling these values and the need for a cultural shift that prioritizes connection and community. The conversation then turns to the impact of loneliness on parenting. Murthy shares that he and his wife prioritize investing in experiences and connections for their children rather than material possessions. They aim to create opportunities for their children to connect with family and friends and to engage in unstructured playtime. They also discuss the challenges of managing technology and social media use for their children, highlighting the need for support from other parents in creating tech-free zones and delaying social media use. Murthy highlights the impact of loneliness on mental health, noting that it is strongly associated with an increased risk of depression and anxiety. He cites a longitudinal cohort study that found adolescents who spend more than 3 hours per day on social media face double the risk of experiencing poor mental health outcomes. He also mentions that even younger children are using social media extensively, with about 40% of kids aged 8 to 12 using these platforms. The Surgeon General expresses concern about the lack of evidence regarding the safety of social media and the growing evidence of its harm to children. He believes that social media platforms need to be more transparent about the negative effects and provide sufficient data for researchers to assess the impact on mental health. He compares the situation to a car seat manufacturer hiding safety data, emphasizing the need for external accountability and federal safety standards. Murthy acknowledges that technology companies should be willing partners in addressing the issue, but he doubts that relying solely on them to fix the problem will be sufficient. He believes that external accountability and government intervention are necessary, and he mentions the bipartisan support for legislative and regulatory change. He also emphasizes the importance of involving parents and users in the decision-making process. The Surgeon General discusses the broader issue of mental health and the need to address root causes such as loneliness and social media. He calls for a comprehensive approach that includes improving access to treatment while also addressing the underlying factors contributing to mental health issues. He mentions the importance of building a moral reawakening in society and choosing a path of love over fear. He believes that love is a source of strength and healing and that it should guide our decisions and interactions with others. In terms of his legacy, Murthy expresses his desire to build a broader vision for the country and define its identity based on core values. He believes that choosing love over fear will lead to positive changes in healthcare, education, and economic opportunities. He emphasizes the need for a collective effort and the involvement of individuals, communities, and leaders in creating a better future. Thanks for watching. If you enjoyed the video, make sure to like and subscribe.